Are you a seven-figure practice owner that wants to do more without burning out? Join us for the Seven-Figure Practice Retreat, a luxury mastermind where high-level practice owners step away from the day-to-day to build systems, strategy, and freedom in the Dominican Republic. This February, spots are limited, so apply now, and our sponsors are covering 95% of the cost over at practiceofthepractice.com/7. Again, that's practiceofthepractice.com/7. This is the Practice of the Practice podcast with Joe Sanok, session number 1268. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast, where we help you build a thriving private practice you absolutely love. We talk with people in the marketing spaces, in clinical spaces, in personal stories, people that are influencers in different ways, all these things that it takes to really help us grow our practices. To me, it's really important to not just be stuck in our own silo. I forgot what book it was that I read a while ago. I want to say it was a Malcolm Gladwell book, where he was talking about an emergency room in England that was really struggling, and they realized that when they were transferring patients between the emergency room and like the other, like their kind of care room, that's when the most problems happened. Like, medications weren't handed off. And that team actually went and trained with like a Formula 4 race car driving team that does the pit crew, like the changing of the tires. And in the things that they learned in that, they then applied in the ER, and their safety rate just increased so much. And that's really been a story that's stuck with me of how we need to hear from other people, how we need to not just be stuck in our, say, social work world and just only look at our social work ethics, but to look at critiques of what we do, of thoughts of what we do, of what people that are doing that helps mental health move forward, maybe not in the same way that we're working on it, which is why I'm so excited today to have Anna Runkle with me. Now, Anna is also known as the Crappy Childhood Fairy and is the creator of the popular YouTube channel, blog, courses, and coaching program that provide practical tools for adults to heal dysregulation and other common trauma symptoms, and to begin feeling better and changing their lives in everyday ways. Anna's not a therapist or doctor. Her methods were developed through research, her mentoring of hundreds of individuals over the years, and her direct experience healing her own symptoms of early trauma. With more than 1 million subscribers across YouTube and social media platforms, she is the author of Re-Regulated, Set Your Life Free from Childhood PTSD and the Trauma-Driven Behaviors that Keep You Stuck, and Connectability, Heal the Hidden Ways You Isolate, Find Your People, and Feel at Last Like You Belong. Anna, welcome to the Practice of the Practice podcast.
Thank you, Joe.
Yeah, I am so excited to have you here today. Let's just start with, you did a lot of therapy and it didn't work for you. Tell me about that.
Well, on the one hand, I was lucky. I had, all in all, I think 11 therapists over 17 years, and they were good people. Maybe 2 of them I thought were maybe a little dodgy, but most were incredibly kind, well-educated. They did everything they were supposed to do, but there was some sort of misfit between what I needed and what they could do. And they weren't all in the exact same flavor of therapy either. And I was going to therapy every week whenever I could afford it. And I had this very bad week. This is now over 30 years ago. A very bad week when my mother died and I got attacked on the street.
Oh, wow.
I was beaten unconscious. They were like gang members, just randomly beating people up. And they broke my jaw and my teeth. And, you would think where I'm going with this is I was so psychologically harmed. I kind of took that part in stride. What happened was I was neurologically harmed. I didn't have a brain injury and I had a concussion, but not like a bleed or anything like that. I didn't have anything that the doctors recognized as a problem, really. And I would say if I were to diagnose myself, I obviously had PTSD. It was quite obvious. I had all the signs and symptoms. And in the years since then, and everything I've learned, it's also clear to me that, like so many people, a precipitating event in adulthood sort of opened the genie bottle of all my childhood trauma. And my life went out of control in a bad way. I was in therapy then, and because of victim witness money from the state, I had unlimited therapy. I was going 3 times a week, and we were talking about my mom's death and my mom and, what a terrible relationship we had, and we were talking about the assault. But every visit, I would go out in my car, and this was not just after the assault, but it was worse after the assault. I would be so shaken and rattled and upset, and I would cry. I couldn't drive for 45 minutes. And I got where, I had talked about feeling that way, but it wasn't understood by me or the therapist. It was interpreted as emotional, and that I just needed to talk more about it. And looking back, I think that was like the worst thing that somebody with the way that my complex PTSD was manifesting, it was probably the worst thing for me. And then we told the doctor that I was freaking out so much. The doctor put me on Xanax, which was the next worst thing that you could do for the person in my situation. And luckily, I got suicidally depressed through those couple of months. It was like people will. And luckily, before I had a chance to do anything drastic, I discovered a couple of techniques that were super simple, cheap, easy, that helped me fix that very quickly. And that's what sort of set my life on a new course. And a lot of what I teach now as a layperson is like how I did that. What are those techniques? How did I apply them?
Yeah. So what did you discover worked for you in regards to things outside of therapy?
Well, what I know now is it was the talking that was very triggering for me. It would throw me into a state of neurological dysregulation. But words like complex PTSD or dysregulation, they weren't even in the vocabulary back then. It just wasn't something that we knew about, and so it couldn't be framed as that. But looking back, and once it was, 2014 when Bessel van der Kolk's book came out, I'm jumping forward to just like, I read that book. I read that book because I had had an outburst of emotional dysregulation at my then fiance, and he insisted that I deal with that. And I bought this book, and I learned about the word complex PTSD and dysregulation. And it was like this huge day in my personal history. I was like, that is totally what I have. It was just like word for word, my whole experience. I'd never heard anybody describe it before. So I'm just jumping there to say, I know now what was going on with me. But what I learned was this, I was 30. This woman who showed me was 23, covered with tattoos, cursing. She would say the F word and God alternately in every sentence. She was very rough. And she had been an alcoholic on the streets of the Tenderloin in San Francisco as a teenager. And she had been sober for 4 years. But her personal history was when she got sober, she got really depressed. And that's not unusual, as you know. And she needed something stronger than what she was getting in AA, which helped her get sober. And there was this woman in AA named Sylvia, who ended up being one of the founders of Narcotics Anonymous in Los Angeles. I think she had done that before the time when Rachel met her. And she showed her a way that you could work the 12 steps in a way that very few people do. Everybody does it differently. This is a very rigorous daily thing where you are writing your fearful, resentful thoughts and feelings on paper, asking your higher power to remove them. And then she said, go learn transcendental meditation. And that was the technique as I learned it. And I didn't learn the meditation right away. I just started the writing exercise. Well, I had a lot of anxious, angry thoughts. Let me tell you, I was like packed with them. My head was so full. And that's what I would say. That's what it's like to have PTSD. It's just like this bag of cats in your head. It's really hard to like take information in or do anything with it because there's already just so much in there and it's not processing. It was one of the joys of my life. I took a class, an online course on the neurobiology of trauma just to learn a little bit more about it. And I was like, that's just to have like names and structures that explain my experience. But the bag of cats, it's like it's an injury to the ability to process thoughts and feelings. And I'm like, there it is. That's exactly what it is. There's something so healing to just when there's finally a name for what you've been struggling with all your life. And then you're just like, okay, so I'm not crazy and I'm not even weird. I have really normal symptoms for somebody who grew up like I did. And so she taught me this. It's a very simple writing exercise. I teach it in a free course. I'll give you a link to share with people. It takes a little longer than a podcast to explain the nuance of it. It's a bit nuanced, but it's simple. And all you need is a pen and paper. You can do it anywhere. And then I teach people a simple form of meditation. You don't have to go learn a particular form, but a relaxing form just to relax your mind for a while after you write. And it worked. It's like one of the few silver bullets I've ever found in my life. I just popped out of I popped out of this chaotic mindset where I was barely functioning. I was about to lose my job. I was shooting my mouth off. I had acute PTSD symptoms, and I popped out of it in 2 weeks and was able to focus my mind better than I had ever been able to do before. And I also got emotional relief from it. Now, unfortunately, it took years to change all the life problems I had accumulated from living that way up until the age of 30. But when you can, it's re-regulation. I now have the word for it. It was helping me to re-regulate a very dysregulated nervous system. And like some people seem to really benefit the most from more somatic and body-centered methods for doing that. And some people are like me, they're thinky. I'm mostly thinky, and it's thoughts, it's stuff going on in my head that feels like walking around with headphones on that are just like blasting heavy metal. It's like that. But I'm at the party trying to pretend that I heard everything you just said. But I'm actually quite unable. My attunement is just shot. And that's what it was like to live with complex PTSD too. My attunement to other people in my environment were not very good. They were not very reliable. So a lot of conventional advice like, just feel your feelings or breathe or trust your gut. It just wasn't really good advice for me. Because those things, there's this intermediary step where you have to have your nervous system actually like working for that to be good advice.
Well, walk us through kind of the phases of re-regulation and some of the techniques that are helpful in those phases.
Well, what I teach people now is a couple of emergency measures. I don't know. I think I have over a dozen that I consider go-tos, and it's anything that I'm kind of iconoclastic. I don't like things that I feel are really metaphorical, spoken of as if they're literal. And so getting back in your body, that's a metaphor. I'm always in my body, maybe until I die, right? But I know what it means. I know what it means to be dissociated. I've been in that. I've felt like that before. But just to give your physical senses a little jolt, something like a cold shower, washing your hands in warm water and feeling the soap, bouncing your butt up and down in the chair, stomping your feet left, right, anything to start talking to your nervous system and saying, come on, come on. The really good thing you can do, if you could do one thing, I would say just move your body. It's a body thing. That was the great misunderstanding of my younger days, was that this was all psychological and that the thing to do about psychological problems is talk about them. And for me, that language, the verbal language thing, it's a pathway loaded with triggers, whereas I could write about my feelings and I could express myself, which of course we have to express ourselves. And of course we need to be heard and validated a bit around that. But I think I've ended up disagreeing with the idea that if you talk about something for enough years that you will recover. That was certainly not the case for me. So dysregulation for me it would explode if I were to talk about trauma. And to this day, it can be like that. So when I'm making YouTube videos, if it's going to be about something personal, I will write the script and read it off a teleprompter, which fortunately I'm good at. You can hardly tell. But that way I'm not triggering myself and all of a sudden my hands and my face are going numb and my heart's pounding and I'm going into some sort of like nervous system reaction as if some old story is still happening. Because my body can still do that. It does it a lot less. And I've had 30 years now to keep practicing. When I write, I immediately start to release, stress. I've been writing and I advocate write with a pen or pencil, get that friction in your hand. You may know the work of James Pennebaker, who worked on expressive writing. He's become a friend and mentor. He endorsed my book. And it's just another one of those moments when I read the peer-reviewed studies that have come out about the therapeutic value of writing. It validated my experience so much. Like, I'm not just crazy. This is not just woo-woo. Writing is a very helpful way to express yourself, and you can read it to another person. And if I'm the guinea pig of this technique, you can read it to them. It's not triggering to read what you wrote. It's just triggering to say it when you're recalling it. That's my experience. When I started putting these ideas on YouTube, I found out there's so many people like me. And there's just like thousands of people coming back going, that's me too. No one's ever described what it's like before. So one happy thing is I didn't feel understood at the time. At the time when I said, you know what, I've totally changed. I think I don't want to talk about my mom anymore to my therapist. She thought that I had some kind of a bad breakdown or something that was making me act delusionally happy, which I understand because I was very bummed out. But I hung out for a while to just kind of time test the shift in me. We didn't have the word re-regulation, but I was re-regulated.
Mm-hmm.
I was re-regulated, and I knew how to do it whenever I needed to do it. I needed to do it a lot. I was constantly at work pretending I was taking notes on something, but I was secretly doing my writing exercise. And then I would come back and be productive and attentive. Later, I saw that therapist in a 12-step meeting that I went to. Because when I left therapy, I said, I'm going to go to this 12-step meeting for families of alcoholics, and I'm going to keep doing my technique because it actually like brings me down and upsets me to talk about the past anymore. I don't want to do it. And she said, okay. She felt like she had done her due diligence, that I was okay. But then she showed up there. But it was this weird, uncomfortable thing. Like she never said hi. It was this weird thing. So there's this funny gap there when you figure out something that helps you. The best thing that a therapist can do is be like really interested in it. So today, the Royal College of Psychiatry uses my content to teach patient-centered care and to teach what is it like to have complex PTSD. And I'm very honored by that, and it's very meaningful to me for there to be that connection rather than there being something like you're doing something wrong if you found something that helped you outside of the old way.
Yeah.
Yeah.
Now, it's interesting because I think that some therapists might hear their clients say, I don't want to talk about my mom anymore, as avoidance.
Yeah.
And they make that maybe mistake.
Yeah.
What questions should they ask themselves if a client does find something that's helpful, that's maybe outside of what they typically would ask clients to do? Like the client discovers something. What do you wish your therapist, would have said or done at that point?
Well, with all respect to the complication of it all, because people could be doing something quite dangerous out there. There's all kinds of cults. And I mean, traumatized people are so vulnerable to cults, right? And that's something that really interests me. And being that I grew up and lived in Northern California, the San Francisco Bay Area, there's like full of crazy ideas about what you need to do to fix your life. There's literally 1,000 things you could choose from. And, in my life, and certainly sitting through 25 years of 12-step meetings, I've seen it all, and it's not all good. So therapists are right to ask questions about it. Yeah. But I think the paradigm that I busted is that I kind of popped out of depression. I popped out of just like the mental discord that I was in, that I popped out. That didn't fit her paradigm of what's possible, that it was supposed to, she was often saying, I'd say, I feel like I'm in a pretty bad place here and it's getting worse and I don't know what to do. She'd go, well, it's going to feel worse before it gets better. It's going to take a long time. I wish she hadn't said that. It's not true. There are some things that take a long time, but I think when you're in emotional distress and stuff that I was afraid to articulate to her fully, but she knew I was feeling suicidal, as many people with a head injury and PTSD will. I wish... Yeah, I wish she had backed off the storytelling, but that was not her training. Her training was to go deeper, to help me get to whatever truth was there. That idea that the truth was going to set me free. I think my experience is, I think too much emphasis is on the past and what other people did. That it matters, but it's a necessary part of our healing. But where the healing really gets rocking and rolling is where we're looking at our own agency. And like, where was that little decision I made where I ended up in this bad situation again? And at that time, I was making some very immoral decisions. I was very self-centered. And again, traumatized people kind of are and must be self-centered, but I had this kind of wicked edge to me. I was not kind to people. I talked about myself more than my turn. I would judge people quite a lot. And I don't think these were narcissistic behaviors. I don't think I have the disorder, but I had the behaviors. And I know enough traumatized people to understand, like, yeah, it gets that way. So me talking about my mom for years it had expired its usefulness so long before. And what really helped me is this 23-year-old tattooed girl. Like at the time, one of my biggest problems in my life at that time was I was obsessed with this guy who was married and didn't want to be with me. Like before he got married, we thought maybe, and then he changed his mind and he married somebody else, and then we stayed friends, and which was considered normal at the time. I wouldn't do it again. But I was just like so effed up about it all the time. And, we'd spend time together and talk, and I'd be jealous, and I was lying about how I felt. And it was just such a mess. And she would say, how do you feel about it? How do you feel about it? Let's draw a picture of it. Let's write a poem about it. And this tattooed girl came in and said, no, we don't do that to married people. You can't just sit there and hurt people's lives and expect your life is going to get better. And I remember it was like somebody threw a bucket of cold water over me, and I was shocked, and I was angry that she was telling me what to do and criticizing my morality, but she was so right. And like the minute I took her advice and I just like cut it off, I felt so much better. I just felt so much better. And so I think there's a couple of things that therapists have ethical limits on what they're allowed to do, but also they might be more reluctant than they need to be, which is to get in there and just say, you're doing something wrong. I would have benefited from more of that. And then she's, which is just to recognize dysregulation for what it is. And I know like the whole field has made so much progress in this. To be able to understand, yes, dysregulation, people need to resource. There's things that need to happen before you just charge in and start talking about the story. Later when I tried even other things, I tried like hypnosis. I tried a somatic body thing. But the people who were, and EMDR, one practitioner who didn't make me talk, it was killer. It worked so well. Another one who was very sympathetic and said, oh, that must have been really hard. Totally dysregulated. Oh. It made me angry. So I really like embrace and welcome and celebrate every bit that the whole field is opening up to this idea that like talking isn't the only game in town.
Yeah. My own therapist, Steve, who I've talked about in my book, I've talked about on this podcast. When I first started working with him, I said, like, I'm a therapist. I don't need your active listening. Like, I get it. If I say this and you say, it sounds like what I just said, that's not helpful for me. And he's always been someone that's been like, well, that's not how I am anyway. And I remember when I was going through my separation and it seemed like it was moving towards divorce, and I gave him some details of what had happened. And I still remember, this was still kind of during the pandemic, so it was a phone call. And I gave him the details, and he just said, you need to effing file for divorce. It was like, there was no like, how do you feel about that? What do you think? Like, do you think you should? It was no, he was just like, that's ridiculous. You need to file for divorce. Yeah. And it just was like, I feel like there's something in the field that is shifting where there's more nuance to just what humans need. There were so many just white male voices that led for hundreds of years, what psychology is. And now there's this diversity coming up that, voices like yours or others that are adding to just the fabric of what it takes to help support humans. Do you want to expand your private pay caseload? Check out Thrizer. Thrizer helps clients better navigate their out-of-network benefits and takes the entire burden of insurance off of them. That means no more super bills, no more insurance calls, and the best part, no more long reimbursement waits. Chances are you're providing a super bill to your clients. Super bills can be extremely overwhelming and challenging for your clients to navigate, let alone needing to wait months for that reimbursement check. Thrizer provides automatic claim submissions, manages claims end-to-end, and the best part, allows clients to just pay a copay for your session, while Thriver covers the rest of your rate up front and waits for the reimbursement on your client's behalf. This is called Thrizer Pay and is already helping thousands of clients access therapy without needing to be out hundreds of dollars while waiting for reimbursement. It's the best way to make your services more accessible and increase your private pay caseload, hands down. Use the promo code POTP for a free trial. That's POTP, Practice of the Practice, POTP. You'll receive waived credit card fees for your first $2,500 in charges. Time to thrive with Thrizer in 2025. Head over to join.thrizer.com/Joe. Again, that's join.thrizer.com/Joe. If you were in charge of training grad schools to have kind of your puzzle piece of what it takes to help humans, what would you hope would be taught in all grad schools for therapists, counselors, MFTs, psychologists, everybody?
Well, a lot of therapists tell me, they go, oh yeah, they train that now, but I know they don't train it consistently. I mean, complex PTSD isn't in the DSM. There's no clear diagnostic criteria. There's no clear treatment criteria. And you go across countries. Like, I'm a YouTuber, so I just talk to people from all over the world. Like, people are all over the place on this. And I think it pays not to be too dogmatic about it. I get people who are like, no, the only way you do this is IFS. It's got to be IFS. Well, I'm just like, that's another thing to me that I'm like, I don't have an inner child. I'm just like, I always say I'm a stick of butter. I'm like basically the same person all the way through. I got through my trauma without that concept. I've known people who did it. Awesome, but not too dogmatic. And then not too dogmatic. I don't like the term trauma informed. I feel very mistrustful of that word. I feel like it doesn't really mean anything. And that when you go on, whatever resource, Psychology Today listings or wherever people find therapists. Well, so I come from a background in running clinical trials and things in healthcare and creating medical education. And in the 90s, healthcare went through this whole thing about the importance of transparency and measuring efficacy and trying to follow better practices and abandon old ones and leave behind the randomness. Whenever a visit is happening behind closed doors and it's all conversation, like what really is happening there? So one thing that hurt me, now I grew up on welfare. I grew up in a commune. My mom was a hippie. We didn't have food. And it was a long time in my life. Well, I mean, as a kid, I started a lot of businesses. I had to get my own lunch money. If I wanted shoes or a coat or anything, I had to buy it myself starting when I was 9, if I wanted to go to the laundromat. So I have this kind of like Charles Dickens childhood where I had to figure stuff out. But it's always offended me when people go, you just need a good therapist. It's like, well, how would I know what that is? Is there a directory? There is not. Is it like, do you have to know somebody? Like, what is good? And then also, so one time I have a blog and I was invited early on to contribute blog posts to a national clearinghouse on trauma. And I got criticized by the editor one day when I was saying, so one thing that really helped me was writing and meditating. And publicly in the comments, she said, Anna, you really shouldn't recommend these things without saying that it should only be done in the presence of a licensed therapist. And I still it's just like my blood still boils when I hear this. I'm just like, are you effing crazy? Do you think everybody has like a licensed therapist to supervise their meditation? Like, what are you talking about? People are scrappy. Hardly anybody has access to therapy. Or even when their insurance pays for 10 visits with whoever, is it the right one for them? Is that person, even though on their bullet points of how therapists will claim they cover all these things, they'll say trauma. But what does that mean? It means so many different things. And so what I love is that more and more this sort of diversification and recognition that different people have different strengths. You remember when schools went to that, what was it, No Child Left Behind, and everybody had to teach to the test? Like, I just don't think therapy should be that way. I think some people are incredibly gifted in certain aspects of helping other people. And I mean, I'm talking about licensed people, but of course also lay people too. And there needs to be room for all of them. About 15% of my audience they are clinical professionals, and I've queried them, I've surveyed them. It's a skewed sample, of course, but I've asked them, do you come for your patients or for you? And they said, well, 93% said I come for me. Like, you could be helping people with trauma, but you haven't yet learned how to re-regulate as well as you'd like. And you could benefit from a layperson like me talking about that. 73% of them said they prescribe it to their patients. So a lot of my people who take my courses and coaching programs were referred by their therapist just because if I were to say, I'd say what I do well is I describe what it's like to have this and what that state is, and just very practical things that you can do to come out of it. But the other thing that I offer people, the other part of my practice there's no word for what I do. It's influencer, but please don't call me that. Such a dumb name. But because I'm on YouTube, and that's principally where people come in contact with my message, I teach, I'm like Dear Abby, kind of. I teach people kind of moral things. They say, what should I do? I'm in this relationship. My partner has decided he wants to be poly, and I don't want to, but I don't want to lose him. What do I do? And it's like, I'm a really good person to talk to about that. And I can get in there and just give direct advice. Be like, if you're not into that, you got to go. Don't pretend. Don't be cool girl on this one. And And so it's not always cut and dried like that. I'm sort of laughing at myself, but I give people a lot of advice about like, how do I go home for Christmas, when the abuser is still there? And how do I
Yeah.
talk to my boss about needing some time off right now when I don't want to tell my workplace, which is, obviously I don't take on legal questions. But what a coach is in contrast to a therapist, like a therapist is trained to go into your past and sort of deal with all that, and then also deal with people in crisis. And so for us, and I say us because I have coaches who work on my team, and I have my customer service team who sometimes is the one who gets a letter from someone we can tell is in danger. And then we mobilize. We find out everything we can. Where are you? And we call hotlines and cops to help them out. It rarely happens, but that's what we do. We would never try to take that on. And then when people present with just the way that they're acting is antisocial. They're just, they can't be in a group with us because they're lashing out at everybody, whatever it is. Then we say, we really recommend that you talk to a professional about this. We can't have you here anymore. Those are like the hard cases for us, is when we thought somebody was a good fit for an easy coaching program, but then it just turns out their problems are too great, or they're crying through the whole thing. And, so I get hate mail sometimes, and they're like, well, do you refer to therapists? And this is the funny thing about when you're working online. I serve the entire world. I don't know therapists. I don't even know where these people live, I've had a girl call in. I do these calls, these big Zoom calls every couple of weeks where I show people the techniques and I take questions and people can ask me questions. And a girl was there. She was in Pakistan. She's hiding in her basement. She's not allowed to get on Zoom. She's not allowed to talk to certainly Westerners or anybody. And so she's whispering, and I'm trying to hear her on Zoom. And like, what do you tell that girl? What do you tell her? I don't know her city. I don't know what to tell her. And so, so we have well-developed ways to say, I really want you to find help. Do you have an auntie or anybody who is sympathetic to your situation? And right now we just want to tell you, we love you. We're on your side. We're here, And so we have this dilemma that we can't be like mandated reporters in that sense of the word that therapists have had to be. So it's an odd role, but it's a role that has brought so much good into my life and so many other people's lives. And I have the pleasure. I walk down the street and people will come up. They'll just start crying. And they'll be like, yeah. And I'm like, I know. You know who I am, right? And we'll just have a hug and then we go our ways. And it's just it's a way of connecting with people in a very loving way, to just share something helpful with them and say, this has been my experience. And it means a lot to them that I know what it's like. Yeah.
And the last question I always ask is, if every private practitioner in the world were listening right now, what would you want them to know?
Well, I would really love for you to learn as much as you can about neurological dysregulation, and not just emotional dysregulation, which is the kind that we can all see from the outside, but the way that it makes it difficult to process information, that verbal instructions aren't really totally great sometimes when we're in distress. We need stuff written down sometimes. I would ask people, don't make assumptions by what I look like, about my race or social class or anything, that means I'm a certain amount of okay. It just means nothing. People with trauma mask just like everybody and can present well. But then again, don't assume that we don't know what words mean or anything. Just ask. Just ask about that. And be sensitive to the signs that somebody is getting dysregulated. And they don't always show on the outside. And so to have some good questions you can ask that don't feel intrusive, and make room for the present day person, for the problems of today. And I know that most people have come around on this, but I know the old school type is still there too. And it's not just the older therapist, but there's this old school approach of like, that must be very hard. It's going to be a lot worse before it gets better. To prioritize emotional relief before anything. I think sometimes the therapy language focuses a lot on mindfulness. And I'll just tell you, as somebody with complex PTSD, mindfulness is never anything I could have done. That's a normal people thing to me, where you're just like observing your thoughts. No can do, maybe now, but so it has to be something simpler than that. And sometimes that felt to me, as a kid who was poor and who couldn't do a lot of things that other people could do, even though I was a great student, even though I looked nice, it felt like elitism, really, to me. You just need a good therapist. Why didn't you get a good therapist?
Mm-hmm.
Yeah.
Oh, so awesome. Thank you so much for all the work that you do. If people want to follow your work, get your books, follow your YouTube channel, where should we send them?
My YouTube channel is called Crappy Childhood Fairy. So is my website, Crappy Childhood Fairy. Hopefully the name makes it very clear. This is not therapy. This is I was just, when people say, where does that come from? I go, do you remember Linda Berry and Ernie Pooks Comique? Or Fractured Fairy Tales? It's just kind of this rough, we're like the scrappy kids who grew up and learned how to function, and we're showing you the ropes. And so that's what it is, Crappy Childhood Fairy. And on the website, you can find the courses and the retreats. And I'm leading a lot of retreats at places like the Art of Living Retreat Center and the Omega Institute and things like that. And then my books, Re-Regulated and Connectability. Connectability is just about out. And this is the book that has been near and dear to my heart. This is a symptom. Who knows? Maybe one day people will say, yeah, Anna Runkle's really the one who brought that one to light. But a universal symptom. We know that it's a feeling of disconnection, but I've gone in and I've described this is what it's like, that feeling of being behind a wall where you can't quite get on the Wi-Fi that everybody else seems to be on, about the nonverbal communication. Mm-hmm. We've learned a lot from autistic people on this, but it comes with complex PTSD too. And we have a lot of ability to learn how to do it. So this book it's got the science, and then it's got a whole series of things that get in the way of being able to connect with people, like being avoidant and being emotionally dysregulated. So I go through some of those and what you can do. But then I get into, it's basically an etiquette book in the end of how to be a good conversationalist. I don't know about you, but I did not learn this at home.
Yeah. Oh, Anna, thank you so much for being on the Practice of the Practice podcast today.
Mm-hmm. Thank you.
So much that I got out of this episode today, just thinking through how we as clinicians make assumptions, valuing things outside of our field, not just having just that single lens. So many great inspirational things. And to see that therapists are joining this community, following her YouTube, is just so exciting. Also, we couldn't do this show without our amazing sponsors. Today, Thrizer is our sponsor. So if you are taking private pay and you're still doing your own manual super bills or just giving clients their receipts, there's a better way to do this. Thrizer helps automate all of this through Thrizer Pay, and they're helping thousands of clients access therapy without needing to be out hundreds of dollars waiting for reimbursement. It is the best way to have your private pay services be more accessible, hands down. Use promo code POTP for a free trial. You'll receive waived credit card fees for your first $2,500 in charges. It's time to thrive with Thrizer in 2025. Head on over to join.thrizer.com/Joe. Again, that's join.thrizer.com/Joe. Thank you for letting us into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.